Do you think you can get all these questions correct? Let's find out. A patient is receiving a blood transfusion and develops chills, fever, and back pain 15 minutes in. What is the priority action? Slow the transfusion rate and monitor. Stop the transfusion immediately. Administer acetaminophen for fever. Notify the blood bank after completing the transfusion. B. Stop the transfusion immediately. A client with chronic kidney disease has a potassium of 6.2. Which finding is most concerning? Urine output of 30 milliliters per hour. Peaked T waves on telemetry. Creatinine of 4.8. Mild periorbital edema. B. Peak T waves on telemetry. A post-op hip replacement patient 6 hours after surgery reports sudden chest pain and shortness of breath. What does the nurse do first? Administer supplemental oxygen. Obtain a 12-lead ECG. Call a rapid response. Position the patient supine and check vital signs. C. Call a rapid response. A nurse is about to give Digoxin. The patient's apical pulse is 54 beats per minute. What should the nurse do? Administer the dose as ordered. Hold the dose and notify the provider. Give half the dose and reassess. Document and continue monitoring. B. Hold the dose and notify the provider. A patient has a chest tube and the water-sealed chamber has stopped fluctuating. What is the most likely cause? The lung has re-expanded fully. The tube is kinked or obstructed. The system has an air leak. The suction is set too high. A. The lung has re-expanded fully. A patient with liver cirrhosis has increasing confusion and asterixis. Which dietary modification is most appropriate? Increase protein intake to support liver function. Restrict sodium to 2 grams per day. Restrict protein intake. Increase potassium-rich foods. C. Restrict protein intake. A patient 24 hours after thyroidectomy reports tingling around the mouth and muscle cramping. What lab should the nurse check first? Thyroid-stimulating hormone, serum calcium, serum potassium, complete blood count. B. Serum calcium. A patient is in alcohol withdrawal. Which medication does the nurse anticipate will be ordered? Naloxone, haloperidol, lorazepam, metformin. C. Lorazepam. A conscious type 1 diabetic patient has a blood glucose of 48. The patient is shaky, diaphoretic, and confused. What is the priority intervention? Administer 1 milligram glucagon intramuscularly. Give 15 grams of fast-acting carbohydrates orally. Start a dextrose 50% IV bolus. Call the provider for insulin adjustment. B. Give 15 grams of fast-acting carbohydrates orally. A nurse receives orders for a patient in septic shock. Which order should be implemented first? Administer broad-spectrum IV antibiotics. Obtain blood cultures from 2 sites. Start a norepinephrine infusion. Administer 30 milliliters per kilogram IV crystalloid bolus. Obtain blood cultures from 2 sites. Thank you for watching. Comment your answers below. Like and subscribe to keep this channel going. We want you to pass.